Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, July 1st. Oh my gosh, how did we get here? Okay, July 1st at 5 p.m. So here we are. It's officially summer. I mean, I know it was summer a couple of weeks ago, but July is summer, right? The summer heat is supposed to kill off this COVID-19 virus, right? Yet the majority of outbreaks are in the southern states in the United States currently. Florida, Arizona, Texas. We are getting hit hard. Now, the fear-mongering media is getting back to discussing the urgent need for our vaccine savior. Our warp speed vaccination of everyone that will create herd immunity. I'm not buying it. Okay, vaccines often take up to 10 years to create, and to create them safely. And with all the steps, there are still thousands of vaccine reactions, or worse, every single year. Okay, so if a vaccine comes out in less than 1 year, the question to ask is, what steps were skipped in the process? Because I promise you, that is what is happening. We know that past attempts to develop coronavirus vaccines always faltered at the stage where they are right now in their clinical trials. Both humans and animals achieved a robust antibody response to the vaccine. Then, when exposed to the real wild virus, the subjects got very sick or died. I would not want to be one of those test subjects, those human beings, those 45 people that have been injected with this vaccine. Don't sign me up for that. Okay, remember, Moderna's phase 1 trial for the messenger RNA vaccine involves 45 healthy adults between the ages of 18 and 55. All subjects have seroconverted, meaning they created antibodies after 15 days of the first dose of the vaccine. So far sounds good, right? At day 43, 2 weeks following the second dose, neutralizing antibodies were at or above levels seen in convalescent serum. Okay, convalescent serum is the serum that they're collecting from people who have recovered from the infection with their antibodies and giving that to people who are currently sick to try in hopes of giving them temporary immunity. So far sounds good, right? Okay. 2 days later, 3 of the 15 human guinea pigs in the high-dose group suffered a serious adverse effect requiring medical intervention. Considerable medical intervention, not just, take a Tylenol. To the hospital. 3 out of 15. Okay. Moderna allowed only exceptionally healthy volunteers in the study. A vaccine with those reaction rates could cause serious problems in 1.5 billion humans if administered worldwide, as they are hoping to do. Children, elderly, people who are have autoimmune disease or immunocompromised, people who have comorbidities. We're not talking about ultra healthy people. We're talking about the entire population of the world, including everybody that has these types of other conditions. The reaction in these people could be far worse than just medical intervention, if you understand my point. Coronavirus vaccine development started back in 2002 after the SARS epidemic. Many countries have been trying to develop a vaccine, and after 10 years, there were 30 promising candidates. The top 4 were given to ferrets, okay, all developed promising antibody responses. Then again came the real challenge, exposure to the real virus. Every ferret died from inflammation in all organs of the body, including the lungs, leading to respiratory failure and death. So what happened was the subjects produced binding antibodies that can't prevent viral infection, but actually trigger a paradoxical immune enhancement. The immune system just goes haywire. 25 of the 45 participants in Moderna's study, 25 of them are showing positive for these binding antibodies, but only 8 out of the 45 are showing the more effective neutralizing antibodies, which are the ones they want and the ones you would theoretically need to protect yourself against coronavirus if you were vaccinated. So 8 out of 45 have the ones that might work, and 25 out of the 45 have the ones that the ferrets had and died. I'm just giving you the facts, my friends. So let's stop looking at the vaccine as a savior and the thing that's going to get us through this. Let the scientists find these medications that they are finding that are helping people, remdesivir, dexamethasone, even the zinc, the vitamin C, all of the natural things that people are using that are helping them get through this. I'm not saying this isn't real and it isn't scary, but the vaccine is even scarier. So if you're pro-vaccine, I'm not stepping on your toes. I'm just giving you the facts, okay? If in 5-10 years they do the proper research and all the proper steps and they go through it and they find a safe vaccine and you want to take it, more power to you. But if this is going to be a mandatory, you need to take it, to save everybody else, we're in for a big load of trouble. On that note, I know it wasn't a good note, but on that note, I hope you guys are having an awesome day. And I will see you again tomorrow for another Live in 5.